Welcome back to the Deep Dive. Today, we're looking at a stack of sources on one of the world's, most ancient and popular functional foods.
We are the mighty Shiitake mushroom, Lentinan edodes.
Right. And these have been cultivated in East Asia for what, over 1,000 years?
Oh, at least. Their love for that deep umami flavor, but also, for this huge range of health claims, everything from extending life to fighting major diseases.
And that is exactly why we're here today. Because when something has that much tradition, that many claims...
It's easy to get lost in the noise.
Exactly. So our mission for this deep dive is, well, it's very strict. We're cutting through all that hype. We're focusing only on the high-quality human clinical trials.
So randomized controlled trials, or RCTs, and systematic reviews that use formal certainty assessments, things like GRADE.
We want to see what is actually scientifically proven.
And that rigorous approach is so crucial here. The sources we've got are these comprehensive, evidence-based reviews that stick to that high standard.
So no test tube studies. We're talking about what happens when real people actually eat these mushrooms.
That's it.
Okay, so let's get the key takeaways right up front. What does the highest certainty data actually tell us?
Well, it really breaks down into three main pillars of, let's say, moderate certainty evidence.
All right.
First, there's really solid support for how it can modulate key immune system biomarkers in healthy people.
Interesting.
Second, and this one's surprising, is its role as a highly effective non-animal source of vitamin D. But you have to know the secret to unlocking it.
A secret. I like that. And number three.
And third, we have to draw a very critical, very fundamental line in the sand about its use in severe disease. It's a point that, frankly, cannot be overstated.
Okay, let's unpack all of that. I think we should start with the chemistry. If we want to understand the benefits, we have to meet the bioactive compounds inside.
Absolutely. The star of the show is a compound called Lentinan.
Lentinan, right.
Chemically, it's basically a complex sugar, a polysaccharide, specifically a beta-glucan with a very distinct structure.
That sounds pretty technical. How should we be visualizing what lentinan is doing inside the body?
Okay, think of lentinan as a very specific key. And it's designed to fit one very unique lock that sits on the surface of your immune cells.
A key and a lock. Got it.
So once you eat it, this big molecule binds to something called a dectin-1 receptor on cells like macrophages, mostly in your gut lining. It acts as an immunomodulator.
So it's not just boosting the immune system, it's modulating it.
Precisely. It's sending a signal that says, hey, be on alert. But it keeps the system balanced. It prevents it from, going into an inflammatory overreaction.
Okay, so that's lentinan, the immune signaler. What's the second compound? You mentioned cardiovascular claims.
Right, that would be arginine. That's the one responsible for the anti-cholesterol effects we see in some studies.
And how does that one work? Is it as precise?
It is, actually. It specifically reduces how much cholesterol your own body makes in the liver. It inhibits a key enzyme. Think of that enzyme as like a traffic cop for making lipids in your liver. Arginine steps in and tells that cop to slow things down.
So it reduces the internal manufacturing of new cholesterol.
Exactly. The mechanism is solid. The clinical results, as we'll get to, are maybe a little more modest.
And finally, player number three, ergosterol. You said this one is tied to sunshine.
Yep. This one's maybe the easiest to grasp. Ergosterol is basically vitamin D just waiting to happen. It's a provitamin.
Okay.
So just like the cholesterol in our skin turns into vitamin D3 with sun exposure, the ergosterol in the mushroom, it converts directly into vitamin D2 when it's exposed to UV light.
And you're saying that conversion is really important for the clinical outcomes?
Oh, it's everything. It's the difference between it being a functional food and just another mushroom.
Okay, that sets the stage perfectly. So let's get into those high-certainty clinical wins. What do we know for sure?
Well, the strongest evidence for just general consumption in healthy people comes from a landmark RCT. It was published by Dye and colleagues back in 2015.
What makes it the gold standard?
They took 52 healthy young adults between 21 and 41 and had them eat either 5 or 10 grams of dried shiitake every single day for 4 weeks.
So not a pill or an extract. They were actually eating the mushroom.
That's right. The whole mushroom powder mixed into their food, a real-world dietary intervention.
So what were the aha moments? What were the numbers that made the researchers sit up and take notice?
The outcomes were incredibly sharp. They were looking at immune cell proliferation.
Okay.
And after just 4 weeks, participants saw a 60% increase in the proliferation of their gamma delta T cells.
60%.
And even more dramatically, a twofold so, a 200% increase in natural killer T cell proliferation.
Wait, hold on. A 200% increase in NKT cells is massive. Can you explain what these cells actually do? Why should we care about gamma delta T cells and NKT cells?
That is a great question because just listing off the acronyms is, not very helpful.
Right.
So think of these cells as your rapid response team, your first-line security force. Gamma delta T cells, they're unique. They patrol mucosal surfaces, your gut, your lungs, and they act fast. NKT cells are more like surveillance drones, looking for and neutralizing abnormal or infected cells immediately.
So eating shiitake essentially upcoded their baseline surveillance system.
Significantly.
Incredible. So a boost for the first responders. What about the gut itself?
They saw an increase there too, specifically in secretory IgA or CIGA in their saliva.
IgA. What's that?
Think of CIGA as your mucosal bodyguards, the protective antibodies lining your mouth and your gut. An increase there means better gut immunity, which is your body's biggest barrier.
And they saw one other thing, right? A reduction in inflammation.
They did. They measured a reduction in C-reactive protein, or CRP, which is a key inflammatory marker.
Okay, so if the cells are multiplying that fast, why don't we have a clear study showing, say, people getting fewer colds? Is there a disconnect here?
That's the critical limitation we have to talk about. The evidence we have is strong. It suggests an alert but non-inflammatory immune state. You're ready to fight but not overreacting.
But
the great certainty here is moderate for biomarkers. We have proof the cells are there and they're activating. We just don't have that high certainty proof that it translates into fewer sick days. That research just isn't there yet.
fair enough. Biomarker success isn't clinical success, but it's a huge step. Okay, the second big win, the vitamin D power-up.
Yes, and this is huge for anyone on a plant-based diet.
Yeah.
Shiitake can be a major non-animal source of D2, but only if you know what to do.
The secret you mentioned earlier. So
Yeah.
I can't just buy them fresh from the store and expect to get all this vitamin D.
Absolutely not.
Yeah.
You have to treat the mushroom like a little solar panel. You have to expose the gill cells, so place them gills up to UVB radiation
From the sun.
from the sun,
Yeah.
or even a UV lamp. And this process is shockingly effective. Studies show it can boost D2 levels from almost nothing up to an incredible 32,000 IU per 20-gram serving.
32,000 IU, that's comparable to a high-dose commercial supplement.
It is, and we know it's bioavailable. Human RCTs showed UV-irradiated shiitake raised blood levels of vitamin D in deficient adults by over 60%. It was just as effective as a commercial D2 supplement.
So that's high certainty evidence.
It is moderate to high grade. It's a simple kitchen hack that turns a savory ingredient into a serious functional food.
That is really actionable science. Okay, let's switch gears, because this next part is maybe the most critical and potentially misleading area of the discussion.
Yes, we need to be crystal clear when we talk about cancer.
The claims are everywhere.
They are. And this requires a very clear, non-negotiable distinction. The best evidence we have for improved response rates, better quality of life, even survival benefits in some cancers like gastric cancer.
Yes.
It comes almost exclusively from injectable Lentinan.
Injectable, not a powder you mix into a smoothie.
Correct. We're talking about pharmaceutical-grade Lentinan given intravenously IV as an adjunct to standard chemotherapy. It's a drug therapy used in clinical settings, mainly in Japan and other parts of Asia.
You said earlier Lentinan is a huge molecule. Why does the route of administration matter so much here? Why can't I just take a high-dose pill?
Because of that size. Think of the Lentinan molecule like a giant cargo ship. When you swallow it, it's just too big to get through the lining of your gut. It has very poor oral absorption.
But an IV.
An IV bypasses the gut entirely. It launches that cargo right into your bloodstream, letting it interact with immune cells all over your body.
So just to be absolutely clear for anyone listening, eating shiitake mushrooms, even a lot of them, or taking an oral supplement, it is not the same thing as this specific pharmaceutical IV treatment.
Not at all. The dietary mushroom is excellent for general immune support and vitamin D. The injectable form is a completely different medical tool. It works with chemotherapy to help the body's immune response. It doesn't replace it.
It's an adjunct, not a cure.
Precisely.
Okay. Let's move on to what's missing. We've covered what's proven. Where do the traditional claims fall short when you hold them up to that RCT standard?
Well, despite all that tradition, shiitake-specific human RCPs for things like longevity, anxiety, depression, or even cognitive decline, they're basically absent.
So any claims that shiitake is a brain food are, for now, just a hypothesis.
Well-intentioned one, but yes. Claims for neuroprotection, for instance, They lean really heavily on animal data or on broad observational studies that link general mushroom consumption,
Not just shiitake.
right, not just shiitake, to a lower risk of mild cognitive impairment. And observational studies can only show correlation, not cause and effect. The grade certainty there is very low.
Okay, let's circle back to cholesterol. We know the ertadenin mechanism is plausible, but how strong is the proof that eating shiitake can actually prevent heart attacks?
The human evidence for those big clinical outcomes is still considered low certainty. We have some small, older studies that show, modest reductions in total and LDL cholesterol,
Modest as in?
maybe in the range of a 7 to 12% reduction, which is not nothing.
It's not, but is it enough to replace standard treatments?
Not based on the current evidence, no. We just don't have those large-scale, long-term trials proving it prevents cardiovascular events over years. So it's a promising dietary tool, but it doesn't replace something like a statin.
And there's another big gap, right? The dose-response mystery.
This is a huge one. Our best human trials are small and short, mostly 4 weeks. We just don't have good data comparing, say, 1 gram a day versus 10 grams a day. And we have no long-term safety or efficacy data beyond a couple of months.
We don't know what happens to those T-cell counts after a year?
We simply don't. It's a critical research gap.
Okay, let's bring this all home. Let's talk practical, actionable takeaways. For immunity, what's the dose that the data actually supports?
Based on that dye trial, the dose is 5 to 10 grams of dried shiitake daily,
Okay.
eaten as part of a meal for at least 4 weeks. If you're using fresh mushrooms, that's roughly 50 to 100 grams or a couple of ounces.
And now for the non-negotiable safety warning. This one seems really important.
It is absolutely crucial. You must always cook shiitake and mushrooms thoroughly.
What happens if you don't?
If you eat them raw or undercooked, you can get something called shiitake dermatitis. It's a very characteristic, intensely itchy, linear rash. They call it flagellate erythema because it looks like you've been lightly whipped.
And why does that happen?
It's linked to the Lentinan. In its raw form, it seems to cause this hypersensitivity reaction in the skin. But the key thing to know is that the trigger is thermolabile.
Meaning heat destroys it.
Exactly. Proper cooking gets rid of the compound that causes the rash, but it preserves the core beta-glucans that give you the immune benefits.
So cook it well for safety. But what about for potency? We don't want to destroy that vitamin D we just made.
That's the balance. Gentle cooking is best for vitamin D too. The sources suggest boiling or simmering for 3 minutes or less is probably optimal to preserve the D2 while still deactivating the rash-causing compound.
Last thing, medication interactions. Who needs to be careful?
2 main groups. Anyone taking immunosuppressants for an autoimmune condition or an organ transplant has to talk to their doctor. Shiitake could theoretically work against that medication.
And the other group.
And anyone on anticoagulants, so blood thinners. There's a theoretical risk of increased bleeding, so caution is definitely warranted.
Okay, to quickly summarize this whole deep dive then, shiitake is a confirmed functional food. We have strong evidence for immune support and great evidence it's a powerful source of vitamin D2 if you prepare it right.
But we have to be honest about the limits. Its role for chronic disease, longevity, mental health, that remains unproven by high-quality human trials. We should appreciate it for what the science confirms.
An excellent dietary tool for baseline immunity and nutrition.
Exactly.
Okay, and here's a final provocative thought for you to mull over. The single most potent, clinically validated health benefit from a shiitake compound, Lentinan.
Requires it to be administered intravenously, like a drug.
So what does that tell us?
Well, it suggests that maybe we should stop expecting dietary foods, even really powerful ones, to act like targeted medical therapies. The biology of our gut is a massive barrier.
But clear separation.
Right. Maybe we should appreciate the whole food for its proven, if modest, nutritional and immune support, and recognize that sometimes concentration and delivery are what separate a powerful food from a prescription medicine.
Something to chew on. Thank you for joining us for the deep dive.